Okay, hello everyone. Welcome to today's COVID-19 daily report. You probably have already heard that we had 0 new cases reported to us in Woodbury County, although an additional 19 cases were reported by the governor and IDPH across the state. But again, no new cases for us. And just remember that moving forward, when you hear about additional cases and things like that, that's always going to reflect yesterday's totals. That's going to reflect those are going to reflect the cases that were reported to us the day before that. So just remember that as you're hearing about new cases. Again, around the community, testing is continuing, and it won't be a surprise if we see some more cases pop up over the coming days. But I can assure you, for those of you that are skeptical, testing is occurring around this community, and so we're gonna, we look forward to seeing more testing increase and more testing numbers and that kind of thing. But with that will also come more positives as well. So today I wanted to take a couple of minutes to talk about the information that is released when we get a case. A lot of feedback that we've been received revolves around the amount of info and the types of info that we get, that we make public when we actually get cases announced. So one of the things to know is that Siouxland District Health Department follows Iowa Department of Public Health guidelines when making decisions on what information to release. Most people know this, but as a general rule, reportable disease records and any other information that may identify an individual is confidential. And I think most of us understand that, right? We may not be, we all have been hit with HIPAA things, at one point or another, so I think we grasp that. What may not be commonly known in Iowa law is that the law actually protects businesses in addition to persons. So that's something that'll come up in other outbreaks that we've had periodically, not so much COVID-19. But in addition to that, protected information also includes other identifiable information that can be used indirectly to identify a person. I think we obviously understand that you can't release a name and a date of birth and social security number. Those are kind of the direct identifiers. But indirect identifiers are those types of information that may help somebody identify someone through other means. If I give you information about a particular case and all you have to do is do a quick Google search or search the obituaries in a newspaper, that kind of a thing, then I've given you information that you can easily identify somebody with, and that's illegal according to Iowa law. And it's especially important to know that when case numbers are low, it's easier to identify a person the more information you get. So right now, the way things are, Iowa has decided that we're going to release information at the county level, not at the cities, not at the town level, because again, we're trying to protect people's identity. Again, you guys, we're trying to do two things at once, right? We're trying to protect people's identity and give people the information that they need to protect themselves. And it's a balance that it's an ongoing thing for us. But in this particular situation, county level is going to be the lowest as far as locations. So people are talking to us also about, well, why aren't you telling us about, places these folks have been? Why aren't you telling us about where they work and that kind of a thing? And we understand that concern because we kind of want to have the ability to protect ourselves and to avoid locations and things like that. The truth is this kind of information has very little real public health value at this point in the outbreak, and it actually tends to cause much more anxiety than the benefits that come from it. So first of all, when we are asking cases about, we do ask cases about where they work, and that's primarily to identify healthcare workers. Okay, because there's different rules for healthcare workers when they have to isolate, because we need our healthcare system to be as strong as possible, and we want as few people to be quarantined and off work and that kind of a thing. So that is one of the main reasons why we're asking people's occupation. But what about other places that they might have been? Shopping, groceries, gas stations, things like that. And we don't get into those kinds of things because, number one, and it's obvious, but it's true, this happened in the past, right? So we can't go back in time and prevent ourselves from going to that location, okay? So, regardless of whether or not you were at that location or not during that particular time, we're asking you to do the same thing now that we're asking everybody to do. Monitor yourself for symptoms, and if you have a fever, if you have a cough, you get shortness of breath, call your doctor. So really the instructions are the same whether you would have been at this location during this time period or whether you haven't been, okay? The other thing is most infections are not happening in casual kind of situations that you're gonna have in a grocery store or a convenience store or that kind of thing. Most of infections are still occurring during close contact, which is why IDPH is asking us to primarily focus on household contacts when we're following up on cases. Okay, so there's multiple reasons why we're not giving a whole lot of locations and things like that. The bottom line is that it just has very little to do with actual disease prevention. It increases anxiety levels when we're focusing on things that we can't control. We would much rather, and we're going to focus a lot of our efforts on the things that we can control, things like staying home when you're sick, implementing the social distancing things that we've been talking about for so long, and practicing that real good hand hygiene. So if we focus on those things, that'll go a lot further than focusing on the things in the past in the places that we might have been. So that's it for today. Tune in tomorrow. We'll have another update and we'll focus on another topic that people are asking us about. Thank you.